we have 100 PTs, right? Those 100 PTs have a patient, me, coming in to them with right knee pain. Of those 100 PTs, what percent, all right, and I'm going to stop sharing my screen for a second so I can see all you guys, because you guys have got to hold something up. What percent of those 100 PTs are going to start, are most likely to start, or going to want to start, or again, I'm a PT, or let's just say this, those 100 PTs see 100 patients with knee pain. How many of them start typically on the injured side? Hold it up. 10 means 100, 9 means 90, 8 means 80. So we've got 90 to 100%. We've got 90%, we've got 80%. James, I just can't see your fingers. We got 100%, we got 100%, we got 90%. Looks like you're putting up 9 of them, James. Connie, what are you putting up?
9.
9. Okay, good. Typical response on that. All right, so now, I guess I don't need to, you guys don't need to see my PowerPoint. I'll have it up for myself. All right, so now, I then asked this. 100 PTs treating 100 patients each, okay? And we noticed that the arm, now we're going to shift up to shoulder just because you can see my shoulder. It doesn't go well forward flexion. Or I do a MOB and I'm assessing the joint and I find out it doesn't like AP. What percent of them, out of with the 100 patients they see, are going to go into restriction to treat them? Hold your fingers up. So 100%, 90%, 80%. I think you got 90, 80, 90, 90. Are you looking at 100, James? I think so. Okay, just spread your fingers out. I'll be able to see them more because it's dark. There you go. All right, exactly. Typical response is that typical thing. Now, I ask you this. Are you one of them? Yes or no? Don't take, well, it depends and stuff. Again, you treat 100 patients, and I am that 100 patients. Am I going to see you pretty much treating like that? Yes or no? Shake your head. I keep shaking it. All right. So good. We've located you. All right. You guys see what you located. All right. Fine. That's where you are. All right. Now I have to show you something. Is that all right. So you're in the group. Okay. So now I have a patient come in, and they say they've been to 4 providers. 4 of you. You all use a different technique, though. Nicole, Krista, Wendy, and Linda. They all went to see. You all use a different technique. Right? And all of you shook your head yes. And they go, I've been to 4 therapists. And they didn't get me better. Or they go to the doctor and say, I've been to 4 therapists. They didn't get me better. Right? And I'm telling the doctor, or I'm trying to tell the doctor that I'm better. Or, right, I'm different. Or whatever. I hate the word better. What does that mean? And I say to the patient, I say, look, I know Nicole, I know Krista, I know Wendy, I know Linda. They're good therapists, without a doubt. All right, this isn't brain surgery of us moving around the body. So if you've been to 4 places, and let's say one's a chiropractor, whatever it is, I said, I'll bet you this, they kind of stayed in this quadrant. Now again, I'm not trying to, of the 100 PTs, if they'd seen 100, I said, did they stay kind of maybe neck, maybe this area, maybe down here? Yeah, I said, cool. We're going to explore. I said, then that area probably is not the cause or the thing that's going to change your shoulder getting better. Does that make sense? So if you saw 4 people, they all stayed in that area with a different technique, but doesn't it kind of mean that maybe that area is not going to be the thing that changes it? And they look at me, they go, it didn't even enter the picture. It was unconscious unawareness that's what they were doing, is unconscious unawareness that there were other areas that might bring it about. Right?